Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us once again here on the program. Our guest is returning guest, Dr. Hugh McTavish. He's company founder, president, and CEO of IGF Oncology. IGF Oncology being a biotech company. They're in the development of targeted anti-cancer drugs, and he's joining us on the program as a returning guest to talk about their lead drug, IGF-MTX. Thank you for returning, Dr. McTavish. How have you been?
I've been good. Thank you, Neil. Thank you for having me.
Thanks for coming back. And for our listeners who aren't familiar with you, when you were here before, give us a little bit of background about yourself.
I'm a patent attorney and a biochemist, and I invented the lead drug for IGF Oncology, IGF-MTX, and decided, being a patent attorney, decided to write a patent application for that and started a company around it.
Now, IGF Oncology, is it strictly focused on anti-cancer drugs, or are there other things that IGF is working on?
Just anti-cancer drugs. So, I mean, we've done some lab experiments on other potential uses outside of cancer, but so far we're just focusing on cancer.
Now, when you start a company, it is a personal endeavor because you're starting a company, but there's a little bit deeper meaning in IGF Oncology for you, I do understand, as a cancer survivor yourself.
Yeah. As I said, I'm a biochemist and then became a patent attorney. Went to law school and became a patent attorney. And shortly after getting out of law school, then I contracted cancer, non-Hodgkin's lymphoma. Mm-hmm. And so my research previously had not been on cancer, and I really wasn't that interested in cancer scientifically. But suddenly, having cancer, I was interested in it.
Yeah.
So I did a bunch of journal research and wound up getting an experimental treatment, actually. And my idea for our lead drug, IGF-MTX, was really an improvement on the experimental treatment I got. And then by this time, being a patent attorney, I thought I'll write a patent application for this and start a company around it, and we'll get FDA approval for the drug and make millions. How hard can it be?
Hey, really easy peasy, right? Well, how exactly does IGF-MTX work?
So IGF-MTX is a conjugate. It's a covalently attached to the old chemotherapy drug methotrexate to a protein called insulin-like growth factor 1, or IGF. We actually don't use so IGF is a protein in your body. We actually don't use the native IGF. We've modified it a bit, but it's basically IGF-1. And so that binds to the IGF receptor, and the IGF receptor is overexpressed on cancer cells of most types of cancers. So this is a way to get the drug relatively specifically, not totally specifically, but relatively specifically to cancer cells, and less of the drug going to healthy cells, so that which is one mechanism for how it is more effective and gives lower side effects than methotrexate itself or conventional chemotherapy drugs in general.
So how's the data looking so far?
So the data is looking really good. We are in clinical trials. In animals, it worked the way I hoped and expected it would.
Mm-hmm.
It was more effective than methotrexate. It was more effective than methotrexate at a 12-fold lower dose than free methotrexate in terms of methotrexate groups. And we had low side effects in animals as well. In particular, we didn't get much decrease in blood cell counts. It's called cytopenia, killing off your white blood cells and red blood cells, which is the usual side effect of chemotherapy and is really the most serious side effect of chemotherapy. It makes you vulnerable to infections and makes you tired. So we didn't see very much of that in animals, and then we've gone through one clinical trial in solid tumors, a mixed variety of solid tumor patients, and in that we saw absolutely no decrease in blood cell counts in any of the patients. So that was a very exciting result. We had some efficacy. Of course, didn't cure everybody, but we had some efficacy in that clinical trial. And so now we're in a clinical trial in a blood cancer called Myelodysplastic Syndrome, or MDS, and that's going on at the Mayo Clinic in Rochester, Minnesota. We're based in Minnesota, so it's not too far from where we are. So blood cancer, MDS, and the part of the rationale for picking MDS was because we're not causing any decrease in blood cell counts, any cytopenia. So that's a consequence. Low blood cell counts are a consequence of MDS itself. As a consequence of the disease, their blood cell counts go down. So they can't tolerate a drug that would further decrease their blood cell counts. So we thought it fit well there. Also turns out that in vitro MDS cells are sensitive to our drug, and that they have a high expression level of the IGF receptor. So it seems to be a good fit for our drug.
What about age as a factor in these trials? Is that taken into consideration in this particular trial, or are we going to wait for the results to maybe look at some childhood or adolescent conditions that may be treated by your drug?
MDS is a disease pretty strongly associated with the elderly. I don't think children really get it. There are some 40-year-olds that get it, but typically it's more common as you get older. We haven't done any clinical trials on children. I'd actually be hesitant to with our drug because children in general have a higher level of IGF receptor on their tissues. Because the function of IGF and the IGF receptor is to cause cells to divide, and that's why it's linked to cancer. Because of course that's the problem with cancer cells; they divide and they keep dividing and don't stop. Children also have their cells are dividing more than adults, obviously, since they're still growing. So I would think we would have higher levels of the IGF receptor on healthy tissue in children than in adults. So I'd be a little hesitant to use this in treating children, but I'm sure it would be. I'm sure that could be done as well.
Well, where can we go online and get some more information about your company, IGF Oncology, and about this new drug, Igf-MTX?
There's information on our website, IGFOncology.com, that also has a link to the clinical trials, in particular the one at Mayo that's going on right now. I should also say, I want to make sure I say that we've treated 2 patients already in the MDS trial at Mayo, and the drug worked on both of them. So they had a life expectancy when they started their trial of 3 to 6 months, and they're both alive at 8 months and basically have had stable disease. So we're excited about that result. But yeah, they can find more information about us on our website.
Great. Well, I appreciate you coming back and talking with us, Hugh. It's been a pleasure as always.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this show are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.